Georgia Stevenson, and today I'm on my way to Harley Street. I'm catching up with Charmaine Chow, the founder and CEO of GetHarley, an exciting new skincare platform that's part of the Index family.
Hi.
Hello.
Nice to see you.
Good.
Welcome to Harley Street.
So, Charmaine, why is your company named GetHarley?
Harley was interesting because it's a name and it's quite androgynous. And I wanted GetHarley to feel like someone you could trust and a friend that you could text. And the history of Harley Street is interesting. It's a famous destination for a lot of elite private clinicians. And I really wanted GetHarley to embody that sense of excellence and quality and prestige.
What was the problem that you were looking to solve, and how did it all start?
Well, I've always struggled with skin. Acne, scarring, eczema, seborrheic dermatitis, and I just felt like, the industry had a lot of new innovation when it comes to branding, ingredients, distribution channels, direct-to-consumer, celebrity marketing, etc. But what was really missing was this place where people could go to find just the thing they needed. And I was living a very busy lifestyle, and I just thought, it'd be great if I could just find a place, a source of truth that could help me figure out just what I needed for my skin. Whether it was when I was breaking out, or whether because I just felt like, I wanted a little bit of glow before the summer, etc. And that didn't exist. And I thought if I could aggregate clinicians and have clinicians make those recommendations, then consumers would really get the best outcomes on our platform. And I knew that clinicians were so time-strapped, were not able to scale themselves. I thought, if I could leverage technology and a better service to make these clinicians much more accessible, then I would be able to solve a problem not just for the consumer, but also the clinicians, and bring them together.
I think my box is actually on its way to our office.
Did you replenish?
I replenished. Should we head over there and see what's come? So the famous stat is that 3 skincare products every hour are launched. And really our belief here is that the world doesn't necessarily need another skincare product. There's a lot of great products out there. What the world needs is a great software product to get the right product in the hands of the right person. So tell us, how do you do this and how does it work?
Where my mind went was immediately to the clinicians who have dedicated years and years to not just studying about skin, but also actually touching, feeling, seeing how skin evolves with different ingredients. And so what GetHarley does is we amalgamate a community of clinicians, bring them onto our platform, and make it really easy for them to make recommendations that, end up on your phone as a consumer, and it's incredibly shoppable for the consumer. So that's what GetHarley does. We remove the friction of getting the knowledge of the clinician into the phones of the consumer.
Yeah. And on the topic of clinicians, you see a lot of products and technology trying to replace existing stakeholders within any market, or replace, expertise that have been built up over many years. And what, was clear from what GetHarley is doing is you're really enhancing and enabling skincare practitioners and clinicians.
Yeah, clinicians are really the heartbeat of GetHarley, and we think about product development and feature development really starting from the clinician. Clinicians tell me that they now can have a living, or they can balance their work both offline and online. Before GetHarley, I would say most of the clinicians we work with have a very brick and mortar approach to their work. Whereas now, they can interact with their patients online, they can meet their patients online, they can review before and after pictures all at the click of a few buttons.
You're a solo founder.
Yeah.
Being a founder is already a pretty lonely job, let alone a solo founder. So what made you want to be a founder?
I didn't want to become a founder. Really what I was looking for was the opportunity to do the best work of my life, or to have a craft. And I think when I stumbled upon this problem that a consumer had, and I found an angle with clinicians, I just couldn't stop thinking about it. So it wasn't like I decided to become a founder, but I was enamored with the problem, and I just couldn't stop working In a way, I empathize with the average clinician a lot. Their patient's experience and the care and outcomes for their patients is really number one and non-negotiable. And so I'm always like, how can we beat their bar? And how do we have these clinicians call me and say, wow, that was like beyond my expectations?
Well, you looking to exceed high standards is definitely something I resonate working with you.
Yeah.
But it's been such a pleasure catching up with you. Thank you so much for taking the time and looking forward to what's next.
The best is yet to come.